Welcome to the Western Wisconsin Journal. I'm Kendra Grams, pastor at First Presbyterian Church here in Hudson, Wisconsin. And today, as we gather in the middle of May, Mental Health Awareness Month, I am honored to host a conversation with Pete VanDusartz, who is the Director of Valley Behavioral Health at Hudson Hospital and Clinic. He's joining me to share more about their efforts to promote mental health and wellness and systems and networks of care for anybody and everybody experiencing mental health challenges. So we're privileged to have him and his perspective. So welcome, Pete.
Thank you. Glad to be here.
It's good to be with you. Let's start with you introducing yourself a little bit more and telling us about your role and work here in the Hudson area and beyond and how you got there.
You bet. Again, my name is Pete VanDusartz. I've been working at Hudson Hospital and Clinics for about 20 years, coming up on 20 years. I've been in the mental health and chemical dependency counseling fields for over 35 years. My current role is I'm the Director of Behavioral Health for what we call the Valley Hospitals and Clinics for Health Partners, and that includes Hudson Hospital, Westfields in New Richmond, Amery Hospital and Clinic, and Stillwater, which is Lakeview Hospital and Stillwater Clinic. So at each of those campuses, we have a variety of different behavioral health services, counseling and different services. And we work to coordinate all of those together and to integrate behavioral health services into overall medical care, both in the hospitals and in the clinics.
Okay, and when you say behavioral health, can you give a little bit more of the scope of what falls under that umbrella of behavioral health?
So behavioral health for the Valley, the services we have in the Valley, first of all, we do have an inpatient psychiatric unit up in Amery, a 10-bed inpatient psychiatric unit. And then at that location, we have some other outpatient services like traditional therapy and counseling. We have programs for change up there, which I'll say more about in a minute. We have outpatient psychiatry. We have some group therapy programs. So that's just at Amery. At Hudson, we have also programs for change, some outpatient psychiatry, and some counseling at Westfields. We have those things, outpatient psychiatry, counseling, and therapy. We also have what's called integrated therapy, which is a mental health therapist who works right inside the primary care clinic. So when you go see your family doctor, go see your primary care doctor, we have a therapist who works right inside the exam hallway and is there as a resource for the doctors to address mental health issues when they come up when you're at your doctor's office to see your doctor. We also have a crisis program I'll talk more about in a minute. That's hosted at Hudson. And we have the integrated behavioral health at Stillwater Clinic too. So a whole variety, mostly outpatient services, and mostly integrated in with other healthcare at all of those locations.
That's great. The coordination, I know, is key to get to whole person and wraparound health. So it's great to hear the many ways you're doing that.
Right. Right. That's really the movement of behavioral health overall, is to change some of the narrative about what is mental illness, what is mental health, because there's always been a lot of stigma about mental health. And somehow thinking that it is a personal problem or a character flaw or even a moral problem, those kinds of things, when in fact it's a healthcare concern. A variety of different kinds of mental illnesses, including substance use disorder, addiction, but other things too, like depression, anxiety, issues with past trauma, things like that. These are healthcare conditions. And so we need to find a way to think about them those ways and to treat them as healthcare concerns at our facilities.
Great. And I know one of the ways you're doing that is through the Programs for Change. And I know that was part of what was featured in the county's recent mental health symposium.
Right.
So let's turn there and start there. Can you tell us more about that specific program?
Sure.
Who it's supporting and that wraparound care that you try to integrate into that?
So Programs for Change is our substance use disorder treatment program. That means we treat addiction and substance use problems with alcohol, other kinds of substances like prescribed medications, opiate-based medications, perhaps pain medications, but other substances as well, like marijuana and methamphetamine. And so these are our treatment programs. Now, we've had Programs for Change, substance use disorder treatment program at Hudson Hospital for 35 years. And there are a lot of people in the community that don't realize that. We've always had treatment at Hudson Hospital. About 6 years ago, we expanded and opened a program up at Westfields in New Richmond. And 5 years ago, we expanded and opened Programs for Change up at Amery. In fact, they're just going through celebrating their 5-year anniversary up at Amery for Programs for Change. Now, what that is it's what we call intensive outpatient treatment. That means it's on an outpatient basis, but it's intensive outpatient, which means people who get involved in our program, if they're involved in primary treatment, they come 3 times a week. Each of those sessions is 3 hours long. And they do that for a couple of months, about 8 weeks. So they're very involved, 3 times a week for a period of time, for a couple of months. And that is mostly group focus, individual counseling, and then we have a lecture series where we teach the skills at Programs for Change. That service starts with a thorough assessment. So anyone who has a concern about substance use, do I have a drinking problem? Does my family member have a drinking problem? Have I developed a dependency on medications or other substance problems? Can come in, sit down with one of our counselors and have a thorough conversation. What is the role of substance use in my life? How has it become a problem? And if so, how serious a problem is it? And what level of care might be helpful? So we have that kind of a conversation. We call that an assessment. And then we determine if treatment would be helpful. If treatment is helpful, recommended, it doesn't mean it would be Programs for Change. It could be inpatient treatment. It could be that there's some detox or withdrawal management that's necessary, or it could be some other kind of referral. But if they're appropriate for, like I said, IOP, intensive outpatient primary treatment, then they can get involved in our program. Once they completed the primary part of our program for those 8 weeks, then it steps down to once a week for 2 hours for an additional 5 months. And so front to back, from an assessment through primary and then continuing care, people can be involved in our program for 7 to 8 months. And that's by design, because what we're trying to do is help them make these changes and learn some skills to address substance use problems while they're living their life and dealing with daily stresses and other kinds of issues, and so that they build a healthy recovery lifestyle.
Yeah, well, so as I listen to that description, and while they're living their lives, have you found people have to take time away from other things to give 3 hours 3 times a week, or how do people balance that commitment to change with living their lives?
Yep.
Yeah, how does that work?
Yeah, and that's a fair question, because it is an investment. You're right. 3 times a week is a lot, and people have jobs and children to take care of and all those kinds of things. But one of the things that people don't understand, a lot of times still in our society, people think of treatment as going away for 30 days to an inpatient treatment program, something like that. And sometimes that is appropriate. That's taking away from everything, taking time off work, away from family, really stopping life. Our program instead is very intensive, but recognizes that people need to still go to work and be engaged in their family and take care of other responsibilities, things like that. And so we try to integrate that around. So yes, it's a commitment, and it's a serious commitment, but you can achieve those same kinds of goals in an outpatient program rather than going away for a month, kind of a thing. And it just really depends on the person's situation if that level of care is needed.
And I assume then you try to work with them, knowing work responsibilities they may have, to figure out when they can make that investment.
And to that end, we have services both during the day and in the evenings. So some folks come in the middle of the day 3 times a week. Other folks come in the evenings only. So our evening programs are usually 6 to 9 in the evenings. And then, like I said, once they get into continuing care, it's just once a week for that ongoing program.
Great. And what's the best place to reach out or get more information if there are questions, and it might be time for an assessment conversation like you're talking about?
So, like I said, programs for changes at Hudson, Westfields, in Richmond, and up at Amery, but we're integrated inside the hospital at all 3 locations, and we're integrated with other healthcare. So, really, you can talk to your doctor about this. They're aware of our program and how to enroll. People can contact us directly and ask questions about our program and what it would take to schedule an assessment. So we do take referrals directly, what we call self-referred, but we often get referrals from doctors, from other counselors, other services, and then they're referred medically. In other words, we take that referral and we can communicate with their doctor about their care.
Great. So it sounds like a great first step, if you have a trusted medical provider or counselor, is to start there and open up a conversation there.
That's totally appropriate.
Great. Well, so let's switch gears a little bit.
Okay.
I know you're doing a lot, and one of the big partnerships across all of the area that you have service in, bringing together a lot of partners, is a program designed to help out with when people present with severe mental health challenges or crises. A lot of us know that often that's in the emergency room, and how do we manage and engage that in helpful ways? So I understand you have worked together to launch a program called Emergency Department Behavioral Health Televideo Program.
Right.
It's a big old mouthful. Can you tell us more, break it down? How did this come to be, and what's the need it's filling?
So, yeah, like you said, when people find themselves in a mental health crisis or an emotional crisis, that's not planned, and it turns lives upside down, and often people end up in the emergency department. Now, that has been going on for many, many years, for decades, everywhere, that a mental health crisis does show up in emergency departments. In the large metropolitan areas, in the large systems like Regions Hospital in St. Paul, because of that, they have built mental health professionals who are there to address crisis in the moment, do an assessment, figure out what needs to happen, and get people plugged in. However, these smaller community hospitals were not able to staff that kind of a resource, and yet, just the same, people were showing up in the emergency department with these kinds of issues. So what we decided to do is try to build a system that is identical to what's going on at a place like Regions out here in the Valley. And when we say Valley, of course, I've already mentioned the 4 hospitals of Health Partners, but there's other hospitals as well. And so what we decided was we could build a team and host that at Hudson, and then do televideo assessment to the other emergency departments. Now, keep in mind, a lot of things are televideo now, but this was pre-COVID. Yeah. So this was much more rare, and when we started this up, and when I say televideo, what that means is from our team at Hudson to the emergency department, for example, at Amery or Westfields, or even Lakeview over in Minnesota, and then do that full assessment, that clinical assessment. When we decided to do that, though, what we realized is you can't just take a system the way it runs in Minnesota and copy and paste it to Wisconsin.
Yes.
Wisconsin is very different than Minnesota in a lot of ways, but one of the ways are all of the laws that pertain to crisis services. So we had to look at what is the expectation, what are the licensing expectations, but most importantly, how is crisis handled in these small communities? And in Wisconsin, it is the responsibility of the County Human Services to build a crisis response service for the community. So we needed to partner with them. But also in Wisconsin, different than Minnesota, when you make a determination that someone is in a full crisis and needs to be put on a temporary hold, so it's called an emergency detention, a 72-hour hold. saying they're at risk of harm to self, that kind of thing. Yeah. In Wisconsin, that's determined by law enforcement and an agent of the County Human Services. In Minnesota, that determination is made by a physician. So if we were going to do this in Wisconsin, we needed to have partnership with all of them.
Yeah.
And that's what we did. We were able to pull in human services at Polk, St. Croix, and Pierce counties and come to the table and build a network where we would have clinical staff at Hudson Hospital. These are master's level licensed clinicians who specialize in crisis assessment, but they would also be certified in the County Human Services at all 3 counties and in coordination with law enforcement.
Yeah.
So when these crisis situations come up, we're ready to go, and we're all on the same page, and we're collaborating together with this team to pull that off, to do the assessment and make a clinical determination. What is the person struggling with? Is there a danger of suicide? But also, is it anxiety, is it depression, or is it a more serious persistent mental illness that would include things like schizophrenia with a thought disorder? To assess them clinically, but then to collaborate with law enforcement in real time, and then collaborate with that other emergency department through televideo and the patient and their family, and then determine if they need to be hospitalized in an inpatient unit, and if so, coordinate getting them to an inpatient unit. That was a lot to build and a lot to collaborate, and it's a true public-private collaboration between the human services and all of these hospitals. And let me tell you the other hospitals. So I listed the 4 that are health partners: Hudson, Westfields, Amery, and Lakeview over in Stillwater. In addition to that, we also collaborate with River Falls, Western Wisconsin Health over in Baldwin, St. Croix Regional Medical Center, and Osceola. So there's a total of 8 hospitals that we cover with that service. So the long and short of it is, when people show up in the emergency department at any of those hospitals, we're there to do that assessment and determine what their needs are.
That's great. And that's 3 counties, and bringing in law enforcement, probably countless potential law enforcement departments.
Right. All the different jurisdictions.
How many there are in Hudson, I can only imagine how many jurisdictions that involves. So a lot of collaboration and coordination.
Yep.
So it sounds like you got this started pre-COVID, so it's been going for a few years.
Yep.
As you've lived into it, what are the outcomes you're seeing? How is it helping to transform the network of care for residents of the area?
Yeah, so we do have somebody that's there who can do that assessment and make that determination, but really, if someone is going to be hospitalized, you have to keep in mind that being hospitalized in a psychiatric unit itself is stressful. It's a big deal for the patient, for the family, all of that. So we look for every opportunity to have the least restrictive or the least severe kind of intervention. So we can do all kinds of things. So we can instead do a written safety plan with the family and come up with follow-up care. Connecting them to maybe a counselor or a psychiatrist, those kinds of things. So that's what we've worked out, and the results are we've lowered those, especially emergency detentions. We don't want to put someone on emergency detention unless it's absolutely necessary. So by lowering that, then we lower that kind of intrusive quality of what's going on, and then built this network. To be honest, law enforcement's happy to be involved. They've got a partner in the hospitals. The psychiatric hospitals where people may be admitted are happy to have our assessment and report. So it's worked really well in that way. We started out with a large state grant to start the program. With that state grant, we were able to offer the service completely free to everybody for a year. And since then, we've worked on finding funding to be able to support that on an ongoing basis. But we have been, everybody sees it as valuable, and it's been pretty supportive.
Great. And so have you been able then, it sounds like, to take people that may have been in an old system, either sent out the door when they shouldn't have been, or put on hold when maybe they didn't quite need to? You've been able to give more information to those who ultimately are making that decision to prevent that disparity.
Beyond just deciding whether or not they need to have an emergency detention, we're doing a full clinical assessment. So we're doing a much more in-depth clinical assessment of what's really going on, what the needs are, the diagnosis, that kind of a thing. So that's been kind of the added quality to that. And then able to explain to the family what's going on. You know, these are really, really hard times when a family is in an emergency department in the middle of the night and they're very scared and have misconceptions about the system and things like that. So now we have a dedicated person who can walk them through that and kind of come out with a plan.
That's great. So as you continue to live into it, what are ways the wider community, other than being informed, can be supportive of this public-private partnership and all you're trying to do to build up this network?
Yeah, I think being supportive that, you know, because County Human Services, those are public institutions, healthcare facilities, private institutions, having a collaboration that's not easy to pull off. Everybody's under their own rules and regulations and requirements, things like that. So just being supportive of that kind of collaboration. This costs money. Having a service like this doesn't make revenue for anybody. It's a cost. And so being supportive that the hospitals are investing. Health Partners has invested a lot into this and continues to do so. The other hospitals outside of Health Partners also invest in this program. So just being supportive and recognizing that they're investing because it's the right thing for the patient.
That's great. Well, so as we wrap up, you have obviously a long, long history in mental health, behavioral health, and as it is Mental Health Awareness Month, I wonder if before we wrap up, you could just share what your 1 or 2 or 3 top things for the whole public in general to nurture mental health and wellness would be.
Yeah,
always
good question.
Reminders.
Yeah, so I want to talk just a little bit more about stigma because, you know, being in this field, in every way, stigma about mental illness, stigma about addiction is a real problem. Now, Health Partners put together a program called Make It Okay, and Make It Okay is a program specifically designed to reduce stigma and provide accurate information about mental illness. It sounds like when you want to reduce stigma about mental illness, you're talking about being nice to people, like think better of them or don't think so badly of them, like it's a political correctness kind of campaign. That's not what it is. Stigma prevents people from receiving treatment, which means stigma ends up killing people. This is data. We know this. In fact, there's all kinds of research to show because people are reluctant to seek help and receive help because of stigma, the fears that they have, what are people going to think, all of those kinds of things, they put off treatment for years. And if you think about getting a chronic disease, a medical disease, like Crohn's disease, for example, and just put off treatment for years, this is a horrible kind of a thing. So reducing stigma is really important. And I just want to say this, Make It Okay is a great organization that anybody can get involved in. And what we do is we train people to be Make It Okay ambassadors. So they go through training and then they can go out and do presentations. And we have all of the resources and materials for them to support them doing these, and it spreads on and on and on. In the 10 years that Make It Okay has been up and doing this, we've trained over 5,000 different ambassadors. And so that's the message, that we need to change the way we think about mental illness so that people realize it's a health condition and will take the step to reach out and get help when they need it.
Yeah. And I can just echo, Make It Okay is a great program. Even I went through the ambassador training.
Oh, you did?
And even to just get that background, I think
that's
great
right
for everybody. So whether you're like, I'm not a public speaker,
right,
or I just wanted more information, I
absolutely
can echo that.
Thanks for saying that. And there is no requirement. You're right. you can go through the training and there's no requirement for you to do anything other than be a little bit wiser.
Yes, which is good. Well, thank you, Pete, for your time, for your wisdom, for your service, and work to provide good supports for everybody and nurture everyone's health and wellness in the Valley. We're deeply appreciative of that, so thank you for being with us.
Thanks for giving us the opportunity to talk about it.
Absolutely. And as we wrap up, thank you also to the River Channel for hosting us as ever. Thank you to all of you for watching and seeking to be more informed as we hope to build a more connected and supportive community for all here in the St. Croix Valley. So until we are together again, may peace and wholeness be with you all.